Hello everyone, welcome to CoreVet. Today in this particular video lecture, we will be discussing about the large intestine as we have promised in the small intestine video. First of all, before starting the large intestine, I will let you know that please open your mind while understanding the concepts of the large intestine, because as we will be moving towards the colon and then the rectum, it would be quite hard to imagine how the muscles are moving and how the loops of the intestine is moving. Okay, so just be open with your mind while studying the large intestine. Starting with the large intestine, if we talk about the large intestine, so it is about 10 centimeter. No, 10 centimeter is about the diameter. Okay, so the diameter in the starting of the large intestine is about 10 centimeter for the first 1 to 1.5 meters. Okay, so in the starting, the diameter of the large intestine is larger. Okay, and the most of the its content of the large intestine is situated at the dorsal aspect and the right side of the abdominal cavity. I hope this part is clear that it is situated uh, in the right. Okay, in the right, okay, in the right side of the abdomen and placed dorsally, means upward. Okay, I hope this is clear. Now coming on to the cecum. Okay, so cecum, it is in what? A blind sac which is having a length about 75 centimeter. Okay, the length of the cecum is about 75 centimeter and its diameter is about 12 centimeter. And if we talk about the capacity, because the cecum is a quite a larger sac, okay, it is a sac-like structure, the cecum. Okay, so it is having a capacity of 7 to 8 liters in the larger units. Okay, and cranially it is continuous with the colon, and the caudal bind end is known as the apex. Okay, let me tell you over here. See, we know that after ileum, the cecum will be continuing. Okay, this is clear that after the ileum, cecum will be continuing. So this this end, which is an enlarging or encircling, is the cranial end of the cecum, which is going to be continuous with the colon, right? And the end, which is the caudal end, this, which is an again encircling, is your what? The caudal end, right? And this end is known as what? Apex. Okay, I hope this part is clear. Now, it will be extended up to the right side of the pelvic inlet. As I had mentioned you that the large intestine is situated where? In the right side. Okay, so up to the pelvic inlet, if this is the level of the pelvic inlet, okay, this is the level of pelvic inlet, right? So the cecum will be extending up to the level of the pelvic inlet. Okay, this is the pelvic inlet, right? This is the pelvic inlet level, and this is the what? Ceca, right? This is the ceca. So the ceca will be reaching up to the level of the pelvic inlet, right? This is clear, right? In some animals, the apex may be curved ventrally, means this this is the straight. If this consider this line to be cecum, so this is straight. But in some animal, the cecum will be slightly curved ventrally. Okay, so this is the cecum which is curved ventrally in case of some animals. Okay, the organ is attached proximal loop of the colon and its dorsal aspect, and with the ileum at its ventral aspect. Again, let me tell you, consider this line to be your cecum, right? And the surface that I am highlighting with the red pen is your dorsal aspect. Okay, this would be the dorsal aspect, and the surface that I am highlighting with the green is the ventral aspect, right? So the proximal loop, proximal loop of what? Of colon is attached at the dorsal aspect of the cecum, and the ileum of the small intestine will be attaching to the ventral aspect of the cecum. That's what the line was saying, right? So it's the right surface of the cranial part and it connect. and the caudal flexure of the duodenum. Okay, so what it's saying over here is that the right surface at the cranial bar is in contact with the caudal flexure of the duodenum. See, this was the cranial end, this was cranial end, right? So the right part of the cecum is in contact with this caudal flexure of the duodenum. Okay, means there is a contact between the cecal right surface and the caudal flexure of the duodenum, right? Now, the ileocecal orifice is very small. We had discussed that also in the small intestine video, and presents a fold inside. Okay, there are quite longitudinal fold that are there in the cecum, right? So considering about the small ruminants, their length, diameter, and the capacity. So the length of the cecum in case of the small ruminants is about 25 centimeter. The diameter is about 6 centimeter, and the capacity is about 1.2 liters. Now coming on to the next part, which is the colon, right? So colon is further divided into three segments. Okay, the ascending, the transverse, and the descending colon, right? The ascending colon is further divided into three regions, which is the proximal loop, the spiral loop, and the distal loop. The spiral loop is further bifurcated into three parts, which is the centripetal coil, the caudal flexure. Oh, sorry, the central flexure. Caudal flexure is in the duodenum. Here it's the central flexure. Okay, I'll be telling how the central flexure is looking. And then the third is the centrifugal coil. Firstly, we will be starting with the ascending colon, right? So the ascending colon will be the very first part of the colon, which will be originating from the your cecum, right? So the very first part which is will be originating from the your cecum will be ascending colon, right? And we have seen that ascending colon is further bifurcated into three regions, which is the proximal loop, the spiral loop, and the distal loop. Correct? Now, talking about the proximal loop, okay. So proximal loop, it is the very first loop that will be exiting the cecum, right? The proximal loop is the first loop experienced by the colon and is situated on the caudodorsal portion of the right side of the abdominal cavity in between the cecum and the descending. First of all, you have to know that the proximal colon is situated caudodorsally in position, means it is situated in the backside of the animal and in the dorsal aspect. Okay, means upward and backward. Okay, that's what's the positioning of the proximal colon. Okay, and it is situated to the right, means consider this to be abdominal wall. Okay, this is the abdominal wall, right? So in the right side of the abdominal wall, right side, the proximal colon or the proximal loop of the ascending colon is situated, and it is situated in between what? It is situated in between the descending duodenum and the cecum, right? Now coming on to the spiral loop. Spiral loop is having further three divisions, which is the centripetal, the central flexure, and the centrifugal. In our 12th standard, we all know we had studied about the two forces in our circular motion chapter, which was what? The towards the center acting is the centripetal, right? And away from the center will be the centrifugal, right? Two forces we had studied, right? So the similar concept is there. I'll be looking you in the, I'll be giving you a brief with the picture also, but wait for the explanation first. Okay, so the spiral loop, we have discussed that there is centripetal coil, the centrifugal, and the centrifugal. Now come on to the picture first. Okay, see. So the very first exit was what? The proximal loop of colon. Done. Done with the proximal colon, and it is situated on the dorsal aspect. You can see it is situated slightly above and in the caudal part. Okay, so that's why its positioning is what? Caudodorsal, right? Now, the proximal loop will be descending in a form of what? Spiral. Okay, that's why it is known as the spiral portion of the ascending colon, right? That's why it is known as the spiral portion of the ascending colon, right? And the spiral is having two centripetal, one central flexure, and two centrifugal portion. Okay, so you can see that the spiral is going inwards. Consider this to be center. Okay, so it is moving inwards, like in a circular motion. Okay, so this region, this portion of the spiral, which is just going towards the center, is known as the centripetal loop. Okay, now it will reach a point. What will be there is it will be reaching a point, this central. So, and there will be a flexure formation as similar to in the case of the duodenum. And when this flexure that is forming at the center will be known as the your central flexure. Right? Done with that? Okay, I can erase this now. Okay. Now from the center, I am again marking the center. Look, this is the center. Now from the center, a loop will be going away from the center and moving dorsally. Okay. Again, a loop is moving outwards, means centrifugal, away from the center. So this loop is known as what? Centrifugal loop. Okay, loop. Right. This part is also clear. Okay. Okay, three regions are clear of the spiral, that there are two centripetal coils, one a center flexure and two centrifugal coils, right? Okay, so these coils are adhered to form a disc which is situated at the lateral abdominal region. Obviously, they are situated in the lateral aspect of the right abdominal wall. Okay, means towards the right abdominal wall itself, away from the midline. Okay, so this is the midline. Consider this to be midline. This is the right abdominal wall. So somewhere here they are adhered here, which is I'm darkening with the red, is the your coils. Okay, and this is the right side of the abdomen. Okay, so away from the midline they are situated in the lateral aspect, right? So these coils are formed in a shape of disc, right? Now they will be forming a distal loop which will continue as the transverse colon. Okay, so this region is going upward, 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 and this wait a second. The the centrifugal coil up to this level, the centrifugal coil, this is the centrifugal, right? Now the region that I am highlighting now, this 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 is the distal loop. Okay, this is the distal loop, right? So it will be continuing as what? The distal loop. Okay, then after the distal loop, it will be continuing as the transverse colon, right? Why transverse? We all know there is a transverse line, means crossing something, right? Transversing something, right? So why it is called transverse colon? Because so consider this again as the abdominal cavity. This is the midline. So what does the transverse colon do? It moves from the right side of the abdomen to the left side. This is the right side of the abdomen. This is the left side, right? This is the left, this is the right. So the transverse colon will be traveling from the right side of the abdominal wall to the left side. That's why it is known as the abdominal, your transverse colon. And in while traveling transversely, it will be crossing what? It will be crossing CMA, cranial mesenteric artery, right? It will be crossing the cranial mesenteric artery and moving from the right side of the abdomen to the left side of the abdomen, right? I hope this part is clear to you all. Now, the terminal portion of the centrifugal part will be of the spiral passes chordodorsally, as I have mentioned, on the proximal loop and forms the elongated distal loop that I had told you earlier. Now, coming on to the transverse colon. So it will be passing from the right to the left around the cranial mesenteric, I have told you, and descending colon runs caudally, okay, and curves near the pelvic inlet and become continuous to the rectum. I had told you all because this this now the highlighting portion is your transverse colon, and it will be moving backward to be continuous as a descending colon to be continuous as a rectum, right? That's what the text is signifying. Done? Okay, so the cecum, wait a second. The cecum, ascending duodenum, and the proximal distal loop and the cranial part of the colon are adherent toward by the fatty connective tissue around the root of the mesentery. Means this text is representing how the regions of the cecum, ascending duodenum, proximal loop, and the distal loop all are adhered by the fatty connective tissue and attached to the root of the mesentery. And the mesentery is nothing but the peritoneal fold, right? Now, talking about the body of the colon, do not have any tinea and the circulation. There aren't any circulations that are there in the colon. There is no circulation present in the colon, right? And villi is absent in the mucous membrane. You can refer the histology for that. Okay, you can have a better look over there. And few pair patches are present in the mucosa. Talking about the sheep and goat, the small ruminants, the length of the colon is about 4 meters, and the last coil of the centrifugal part of the colon is closely related to the jejunum. Okay, so the last part of the centrifugal is closely in relation with the jejunum. Okay, so now with this, we are done with the second portion, which is the colon. Coming on to the rectum, which is quite a complex because some taint muscles are also involved over here in the case of the rectum, right? Now, firstly, discussing about the rectum. Okay, we all know, first of all, what is the terminal portion? Done. See, while studying anatomy, just distribute the lines first. Okay, when you will be distributing the lines, when a point wise and understanding them, then it will make your concept clear, very clear, right? Now, first of all, the terminal portion of the intestine, done with that, and having a two portion. Okay, the cranial part and the caudal part. Cranial part, obviously, the end of the rectum. If this is the rectum, okay, this is the rectum. So the end of the rectum, which is facing towards the cranium or the head, is the cranial part, right? And the end, which is obviously getting out or the backward, is your caudal part of the rectum. Done. No confusion over here. There are two portions. So one part you have to understand that as the caudal part, this is the caudal region, caudal part of the rectum. This is the rectum, right? This is the caudal part. This is the cranial part, right? This is the cranial part. So there is one part you have to remember that the cranial part is only covered with the fold of the peritoneum. Okay, the cranial part is only covered with the peritoneum, and the caudal part, which is little dilated, is not covered with the peritoneum. That you have to remember, right? And the wall of the rectum is quite thick as compared to the previous portion of the large intestine. It is comparatively thicker in and having the constriction and the dilatations. Okay, as you will be moving backward, na, you will be feeling that there are certain dilatation. Earlier, if we see that this is the cranial part, but as we move caudally, there would be dilatation and quite constriction also. Okay, now coming on to the muscle wala part. Okay, muscle wala part is quite serious. See, so first of all, we have to know about the rectococcygeus muscle. Okay, it is derived from the dorsal part at the external longitudinal layer of the muscular coat of the rectum. What it's signifying is, see, this is the rectum. Okay, this is the rectum. Now focus on my pen first. Okay, this is the dash dash what I am making is the dorsal aspect, right? This is clear that it is the dorsal aspect, right? So on the dorsal aspect, there is external longitudinal layer of muscular coat. Okay, there is a muscular coat external longitudinal layer above the rectum on the dorsal aspect. Okay, and it will be giving an attachment or it will be deriving the fibers of the rectococcygeus muscle. Okay, from the dorsal part of the muscular coat, which is of एक्सटर्नल लॉन्गिट्यूडिनल लेयर। ओके, मस्कुलर कोट जो है उसकी एक्सटर्नल लॉन्गिट्यूडिनल लेयर, ठीक है, उसकी एक्सटर्नल लॉन्गिट्यूडिनल लेयर से आपकी क्या डिराइव हो रही है, रेक्टोकोक्सिजनस मसल। Okay, now these muscles will be inserting in the second and the third caudal vertebrae. You can see that this is the external longitudinal layer. Okay, and this is the your what? This is your fibers of the rectococcygenes muscle, right? These fibers are gonna attached in the second and the third caudal vertebrae, right? Understood that? Now, the the ventral fiber will pass down and dissociate at the center and join the smooth muscle of the labia in the case of the female and urethra in the case of the male. Okay, so the same muscle of the rectococcygenus, it's also the rectococcygenus muscle do have a ventral fiber too, and those ventral fiber will be going down and give an attachment to the smooth muscle of the labia in case of the female and the urethra in case of the male. So means the one fiber which is attached to the external longitudinal layer of the muscular coat above on the dorsal aspect of the rectum is giving fibers to the second and the third caudal vertebrae. Okay, and the very next ventral fiber of the rectococcygenous muscle will be going ventrally and going to attach either to the smooth muscle of the labia if it is female or the urethra if it is male. Done. Okay, I hope it is clear. And the anus is the terminal portion of opening of the GI tract and situated below the root of the tail. This is the anus, right? This is the anus and it is situated at the root of the tail. That's very clear. The anal canal is about 2.5 centimeter in length and the mucous membrane is continuous with the skin. So this region, so this portion will be continuous. Okay, this will be continuous from the skin, right? And the mucous fold of the cranial part in the lumen are known as the anal columns, and the caudal part is covered with the skin. So this is the cranial region. Okay, this is the cranial region, right? This is the cranial region, and here would be the what? The anal column, right? In the cranial part. Okay. Now discussing about the ani internus and the externus. Okay, so the sphincter ani internus is formed by the thickening of the inner circular muscle of the rectal wall, and the stripe is situated external to that internus is known as the externus. Sorry. So see, this is the lumen, okay, of the rectum, correct, and this is the wall of the rectum. Clear? So there are certain circular muscles, okay, which will be giving rise to the inner circular muscles. These are the inner circular muscles, and they will be giving rise to what? Sphincter ani internus. Okay, so the inner circular muscles that are there in the wall of the rectum will be giving rise to your sphincter ani internus. And external to that sphincter ani internus, there is striping of a muscle which is known as the sphincter ani externus. When you will read the text, you will be going to understand the same that from the wall of the rectum, there are certain circular muscles which will be giving rise to the sphincter ani internus, and external to that particular sphincter ani internus, there will be a sphincter ani externus muscle. Okay, and the fibers of the levator ani muscles that will be attaching to the sphincter ani externus are originating from the medial aspect of the ischiatic spine. While you will be in the coming lecture, you will be knowing about the ischiatic spine and to the medial aspect of the ischiatic. See, this is the ischiatic spine, and to the medial aspect of this ischiatic spine, the levator ani muscle originate, right? And that levator ani muscle fibers will be going to attach at the site of the sphincter ani internal, oh, external, sorry, sphincter ani external, the blue one. Okay, Now, the levator ani is a thin muscle which originates from the medial aspect of the ischiatic spine, I have told you, and insert at the external externus. Okay, an inconstant band on unstyled muscle arises from the coccygeal vertebrae and passes down under the levator zona and joins or follows opposite the side below the anus. Okay, so from the coccygeal vertebrae, a band, an unstriped band of muscle will be originating and passing down. This was the levator ani. Okay, under the levator ani, it will be passing and going to attach. Okay, and going ventrally to the attachment of the muscles, right? And it will be going to continuous with the constrictor valvae in the case of the female, right? Constrictor valvae in the case of the female, and in the case of the male, it will be continuous with the retractor penis, sorry. Okay, I hope this is clear. So in the case of the female, it will be continuous with the constrictor valvae, and in the case of the male, it will be continuous as the retractor penis. So this was all about the rectum also. I hope you guys had understand certain part. If not, you can go back and rewatch the video if you had time. Okay, because the rectal portion is all about the muscles. Okay, how the muscles are arising, from where it is attaching. Okay, the primary is the rectococcygeus muscle, the sphincter ani, externus, internus, levator ani. So the muscular portion is quite confusing, and the loop region is also quite confusing to someone. And this was all about the large intestine also. So thank you everyone.